Which of the following statements regarding the evaluation of hemoptysis is true? A. Chest computed tomography should not be obtained in patients with massive hemoptysis if this delays initiation of bronchoscopy. B. Chest CT should be obtained in any patient with moderate bleeding even if the initial chest radiograph is normal. C. Conventional angiography is the preferred diagnostic test to detect both bronchial and non-bronchial arterial causes of massive hemoptysis. D. High-resolution multidetector CT, even with recent advances in technology, remains diagnostically inferior to angiography. E. In patients with massive hemoptysis, plain films accurately localize the site of hemorrhage in less than 50% of patients. Answer is B. Chest CT should be obtained in any patient with moderate bleeding even if the initial chest radiograph is normal. In patients with massive hemoptysis, plain films may localize the site of hemorrhage in as many as 80% of patients. However, high-resolution multidetector CT of the chest is the principal diagnostic test to detect both bronchial and non-bronchial arterial causes of massive hemoptysis. CT is diagnostically comparable with, but less invasive than, conventional angiography, which currently is done as a combined diagnostic therapeutic modality. A chest CT scan should be obtained in high-risk patients, smokers and oncology patients, or in any patient with moderate to severe bleeding even if the initial chest radiograph is normal. CT localization of hemorrhage can expedite bronchoscopic evaluation or guide subsequent interventional procedures. A 50-year-old man presents after an episode of hemoptysis. He describes coughing up several large clots of dark blood. During his evaluation, he coughs and expectorates approximately 5 ml of clotted blood. The patient's vital signs are normal, and no abnormalities are noted on physical examination. His chest radiograph is normal. Which of the following is the most appropriate next step in the management of this patient? A. Admission to an observation unit. B. Consultation for bronchoscopy. C. Consultation for percutaneous embolization. D. Discharge home with follow-up in 24 hours. E. Obtain chest CT scan. Answer is E. Obtain chest CT scan. Since the advent of high-resolution CT, radiologic evaluation has had an integral role in the evaluation and management of patients with hemoptysis. Unless the initial chest radiograph is diagnostic or the patient is hemodynamically unstable, a chest CT scan should be obtained in most cases. Further management strategy should occur in conjunction with pulmonary and thoracic surgery consultants, guided by the CT results. 8-year-old man with a single lung transplant presents to the emergency department with what appears to be large volume hemoptysis. He was just discharged from the endoscopy suite, where he had a number of surveillance biopsies performed. He looks pale and diaphoretic with an initial oxygen saturation of 71%. After placement of an intravenous line and supplemental oxygen, the next most appropriate step is A. Blood transfusion. B. Contrast-enhanced CT scan of the chest. C. Intubation. D. Thoracic surgery consultation. Answer is C. Intubation. This patient is profoundly hypoxic, will need imaging outside of the ED and invasive procedures. All resuscitative and procedural efforts will be futile without intubation and maximal oxygenation.